Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Michelle Hedding. Michelle is the Spiritual Care Coordinator at Washington Hospital. She received her master's degree in spirituality and culture from the Sophia Center at Holy Names University. She is a registered nurse with her master's in nursing. Michelle is also a certified hospice and palliative care nurse. She worked at Washington Hospital as a staff nurse prior to her current role as the Spiritual Care Coordinator.
Welcome. Thank you for braving the cold tonight to come out to hear this talk. One thing I want to start out to acknowledge is that you guys are living with this disease. So while I may have some advice and tips, I think each one of you has a lot of wisdom. So we're going to have some time in the presentation to share some of that as you're comfortable. So as Vida said, I am a nurse. That's what the RN means of my credentials. The MA is a master's in spirituality, which is how I got into this role of spiritual care nurse. The master's in nursing, and then at the end, I'm also a certified hospice and palliative care nurse. So as I tell people, I wear many hats. Tonight, I'm wearing the hat of the spiritual care nurse. So I won't be giving you guys detailed clinical information about diabetes. I'm more going to talk about the psychosocial, spiritual side of getting through a really tough time of the year living with a chronic illness. So without further ado, this is kind of a roadmap, maybe like a little agenda for what we're going to do tonight. I'm going to talk about grief and loss associated with chronic illness. And I don't know if that's a topic that often gets talked about, but I like to face things kind of head on. And there is definitely grief and loss involved in having a change in your health status. So we're going to talk about that. Then we're going to really focus mostly on strategies for creating support. We're going to have some time to share about successes that you guys have had. Again, like I said, you guys are the ones living with the disease. So I think some of that wisdom can get shared amongst you. And then at the end, we'll have time for questions and answers. I realize it's a small group, so I'm hoping people will participate, but we'll see how it goes. So grief and loss. A lot of times we just think of grief and loss related to losing a loved one. Whenever you have a change in your health status, that's also a loss. So acknowledging that loss can help you to sort of get through that and to heal from that loss. And that's a loss that you live with every day. So the other thing to keep in mind with grief is that it's personal. Your grief is different than my grief. Your grief is different than her grief. And it's not linear. It's not like there's a certain stage and step and, by week 3 you should be in a certain place. It just doesn't work that way. This is a very, very oversimplified stages of grief. Elizabeth Kubler-Ross is sort of the seminal author. She wrote in the 60s, and these are the stages that she talked about. It doesn't mean that they're locked in, that they're carved in stone, but they're kind of the most commonly referred to stages. So I'm just going to give you these examples. You have it in your handout also. And most of it's probably familiar with you, so this is a little bit review. Denial, that's kind of like, this isn't happening to me. Like, I am just going to keep eating the way that I always have. I don't have this disease. I'm not going to face this. Anger would be, I'm really mad this is happening. Bargaining, maybe if I fill in the blank, I won't have diabetes. Depression, obviously, I'm really sad that this is happening to me. And then acceptance is something that kind of comes and goes, but it's adjusting to that new normal that you're living with. And sometimes it's quick to get to that point, and sometimes you're at that point and you may move away from that point, but it's always kind of coming back to that place of just accepting where you are. And during the holidays, keep in mind that other losses and grief can sort of be more up in the forefront. So that's part of self-care, is to be aware of that and acknowledge any losses that you're facing. So identifying allies, to me, this is the best way to receive support. And an ally is someone who is in your corner, who's on your side, who knows what's going on. Diabetes can be very invisible. You guys don't walk into a room and I'm like, oh, there's a diabetic. No one can really identify that just by seeing you. So by identifying trusted friends, family, people that you feel you can be confident they're going to be on your side, enlisting their support during the holidays and throughout the year can help you to not feel so isolated in the disease. So that's one of the suggestions I have for trying to find some support, especially during the holidays. So managing expectations. What that really is all about is planning ahead. You don't show up without kind of having an idea in your mind how you're going to proceed in any given event. One suggestion, bring a diabetic-friendly dessert or a dish. That way you're sharing, which is part of the holiday, but then you also know there's something that you can go to that you will feel comfortable eating and that you know the parameters of. Recently, Maggie, one of the nutritionists, did a class. I don't know if any of you guys attended it, but she had some diabetic-friendly desserts that she gave recipes for. So I'm trying to get those. I may get those to Vida and see if there's a way we can distribute those. The allies that we talked about making in the previous slide, bring them with you to an event so that you'll have support. It's always easier with help. So having someone there that kind of knows what's going on. And you don't always want to tell everyone the details of what you're living with, because you don't necessarily want to trust everyone. But if you have those key people in your life that know what's going on, then you won't have to feel so alone. And then really for me, and during the holidays, you're out, you're shopping, you're in the hubbub, everyone's rushing, you need to get the next best, greatest iPhone 20, and you kind of lose focus on what really, really matters to you during the holidays. As I was reflecting, putting this presentation together, some of the things that matter to me are time together with friends, family, people that you love that maybe you don't get to see that regularly. So I really focus on that when I'm at an event, enjoying that community time, sharing the joy in your life. I think that whatever you pay attention to grows. So finding time to share that. So then talking about spiritual support, as I was doing some research for this, I found studies that show that spirituality, religion have a positive impact on coping with chronic illness. And that can take the form of formal religion where you're at church on a Sunday, or it could just be your own personal connection to something that's bigger than you. A lot of people find spirituality in nature. That might be something that you try to do a little more of during the holidays, although on a cold night like tonight, I would not recommend being out in nature. It's just a little too chilly. And then a quote from this one study that I found from the University of Missouri, that spirituality and religion tend to buffer the negative consequences of chronic health conditions. So just finding that support outside of yourself can help you to feel that groundedness. Spiritual support can include anything from care from congregations, so maybe the community that you have in your places of worship, pastoral counseling, talking to your pastor, getting their take on what's going on, just again, feeling that connection to others. Some find some solace in meditation, which is again a way to calm, as this one person had said, just to find that place of groundedness and quiet that is often really hard to find during the holidays and really, frankly, during most of the year. Forgiveness practices, sometimes there's something that you're having trouble of letting go of. being able to sort of acknowledge and let go of things that you're upset about can help to bring more peace to you, which then again is going to just increase your overall health. Prayer, both personal prayer and having others pray for you. There's been many studies that show that even if it's long distance, I know I see so many prayer chains started on Facebook, and it's amazing to me. There's one person in particular that posts every Saturday. I think he's either a deacon. I think he's a deacon. Every Saturday, I don't even know him. I found out about him through my pastor and became his friend. He posts every Saturday and says, "This is the day that I take prayers." And he just asks strangers on Facebook to receive prayers. And to me, just even that act is such a wonderful act of giving. So that's something to consider. I mentioned before that connection to something bigger than you. Some would call it a higher power, some would call it God, whatever you call it. Just knowing that you're not alone, feeling that connection to something bigger than you. Does anyone else have any other sources of spiritual support that they look to? Yeah.
Yes, faith.
Faith. Faith in God. That is definitely a very big support. So we talked about self-care a little bit. Take time for you. And this, again, is good advice throughout the year, but take a walk. Try meditating. Take a nice deep breath. Just sort of slow yourself down a little bit in all the rush. Take a bath. I mean, I don't know what works for you, but just think about that. Even take time to reflect on that, and that can help you to feel a little calmer. Thank you for your attention and for coming out on this cold night.